Point Wellness, and Wendy Bowser, our Health Benefits Pro. So the meeting is being recorded right now. Just an upcoming thing, Rich Fest is going to be held again this year, and it is going to be from September 25th from 11 to 3. It's at the church right at the roundabout by South Turkey Creek and 73. It is free. They do have asked for a donation, but they only allow one of a kind business in there. So Ruth Day, if you want to get in there and have your own booth, you're welcome to do that. Or if we get enough interest, we can do a Mountain Women in Business, but again, we can only have one person per category, whatever, and we have to let them know ahead of time. Let's see how I can do that. So if you can let me know if you're interested in this, and the reason I'm starting this early is with Elevation Celebration, we did sign up for 2 days and we only had people for 1 day, but we also had 5 people doing their own booths. So that's fabulous. Get your name out there. That's what it's all about. So I'd like to start, and instead of an introduction, because I think we all know each other today, let's just name our business and what kind of a client are you looking for? Because it changes from time to time, but just so we know, if we hear about somebody asking about something, we can refer them to you. So in my screen, I start with Deb Evans.
I'm retired, so I'm not looking for clients, but happy to help anybody that needs assistance with their social.
Okay. And Jacqui, I know you're going to be speaking, but what kind of client are you looking for?
Sorry, I got the sun right in my face here this morning. So I'm looking for a couple of different kind of clients, actually. I'm specifically looking for nurses. And I'm also looking for, I had a specific client in mind, but I'm not sure that's where I want to go. So right now I'm just looking for people who want to learn to become healthier, who want to learn about health and wellness and want to take a different approach to their health, trying not to use medications and procedures and those kind of things, and a more holistic approach.
Okay, thank you. Ruth, who are you looking for today?
So I am looking for that client who is interested in making a healthy living choice. And I would love to be able to share with everybody how they can do that with the cleaning products that I sell. Personal care and, like I say, cleaning products for your homes or for your offices. And so I have that great alternative. So I'm looking for anybody who's really into the health and fitness areas, because they're going to be key on that area of wanting to make that change in their home. And also just really talk to anybody, really, because just one small change in your home will start to make a big difference in the environment. So that's really, I'm open to any clients, and definitely new moms, because I would just love to be able to share with them about the chemical effects on themselves as a mom, and especially stay-at-home moms, and the cleaning processes. So really, I've got a broad range of people that I'd love to be able to share with. So, yeah.
Hey, thank you. And Josie, you're new, aren't you?
Yeah, last week was my first time coming, but so my business is the Meeting Sanctuary in Indian Hills.
Oh,
so it's a meeting space. And so I'm looking for people that may need a place to hold a meeting or a small social gathering. We're right off 285, and we have indoor space, outdoor space. So, it's funny with the pandemic, a lot of companies haven't even met some of their colleagues because they've all been working from home. So, sometimes they may need to, just meet each other in person in a social gathering. So our meeting space would be good for that.
Great, thank you. Karen.
Yes, ma'am.
What kind of client are you looking for?
anybody that likes to accessorize for business, and that makes a difference too. If you're out there in the public and you want to make an impression, you need to over on there to go with it that just personifies your whole image. And so I do Karen Miller, KSM Designs, and I do make one of a kind. And I custom also. I do not pearls and things, and repurpose, and the clients I'm looking for, anybody that would like to add to their wardrobe.
Great, thank you. Steph, you're on, and Rebecca, you'll be next.
Good morning, Stephanie Berardini. I am usually I'm looking for attorneys who need assistance. They don't necessarily need full-time employees, and they don't want to pay the benefits. So I help those smaller law firms with some paralegal work, and then I also do online QuickBooks, and I'm pretty full right now, so I'm not really looking for clients, but I'm happy to help anybody here that needs help with either of those things.
Great, thank you. Rebecca?
Hi, I am looking for probably right now small business people that need help with training or consulting in the technology arena. So if you have computers and you have software and you need help learning how to customize that to make that work for you, not against you, that's what I'm looking for.
Okay. And Courtney, you're next, and then Cindy.
Okay, it's my first time today, so I'm still figuring everything out.
Oh,
but
welcome.
Thanks. So I have a business, Swim the Number 4 Life, and we have a swim school it was formerly Evergreen Swims, and it's actually located in Evergreen. We have one swim school, and I'm getting ready to open a new location in Evergreen. So I'm in transition right now from one location to another. And what I do is I teach kids how to swim in a realistic setting. So we put them in currents. We teach them how to reorient if they flip over on a mat, on a boat. Really what we do are the 4 pillars. So the first one is we teach them the science of water, and we teach them what sinks and what floats and empowers them with that. And that's from my homeschooling background. Kids just love science. It's like magic. So once that clicks with them, they feel empowered. And then we build on that and teach them that water is also dynamic and it moves. It doesn't stay still like in a pool, and how to apply the strokes they're learning to a river or an ocean or a riptide. And then we also teach them that water's healing. We always teach them you can release anxiety by screaming under the water, doing fun things like that. So that's what I do.
Great. Cindy?
Hi, it's wonderful to see everyone. I have been traveling and not been around a lot this summer. My business is Peace, Clarity, Purpose. I am a yoga instructor, a mindfulness instructor, and a life coach. And the type of clients that I'll be looking for specifically in the fall and beyond are, from a coaching perspective, people that want to get clear on their purpose. They may be in transition, or they actually just might need some level of emotional healing that they want to use a coach for, as opposed to a psychologist or something like that. And also people who want to learn to meditate and become more mindful. Starting in I'm in some advanced certification programs now, both for coaching and mindfulness. And I will be offering some opportunities for people at a very reduced cost to study with me or go through coaching sessions, as long as they're willing to be recorded, because I'll be working with a mentor coach. So I'll put that stuff on my webpage, or I'll send out an email. Usually I send it to Deb. And if you want to get on my email list, you can just do that through my website.
Great, thank you. Audra, you're next, and then Katie.
Yeah, hi everybody. This is my second time with you guys. I'm super pumped to hopefully be able to meet everybody in person at some point soon in the future. I'm a loan officer. I help first-time and repeat home buyers with all their mortgage financing needs, especially in the market that we're in right now. It's super important for somebody to who's looking to buy to really find out what they can afford before they go out and get disappointed. So I'm here to help them kind of navigate through that. And then also current homeowners, you know, there's, especially with property values going up, I'd love to be able to kind of educate them on how they can best tap into the equity that they have in their homes as well.
Okay, thank you, Katie. And then Chrissy.
Morning. My name's Katie Burgoyne. My husband and I own Denver AmRamp. We install handicap modular ramps. They're steel and aluminum, like the one behind me. If you were at Elevation Celebration, we had one there going over to the kids area. We do full ADA home modifications, and we cover the whole state of Colorado. We can accept Medicaid waivers, but not Medicaid. And if anyone else happens to accept Medicaid waivers and has any idea how to do the billing, Stephanie and I would greatly appreciate some assistance. Yeah, so that's it. Oh, we do stair lifts, vertical platform lifts. We can make your home so that you can stay there forever. So that's all.
Sounds good. Aging in place is what it's about.
Yes.
So, hi, Chrissy.
Hi, I'm with Chrissy and Healthy Smiles, and I am looking for a client that has teeth, basically. My perfect client would be somebody who has not been happy with their previous cleanings, and that I can show them what I can do to get their mouth healthy and keep it healthy, get them in a place where they are not having any pain, no bleeding when they floss, just put them in a good oral health so that the rest of their body can be healthy.
Several of us can attest to what she does. Yes. And not last but not least, Mary Pat. Oh, we lost your picture.
I think she's working on. There she is.
There
I think
she
I'm
is.
here.
Well, we can hear you now.
I don't know what happens. Can you hear me now?
Yes.
Okay.
Sure.
Hello, I'm Mary Pat, and I own Evergreen Nursing Services. And actually, I work with a variety of different clients. Right now, I am working with clients with end of life, who are approaching end of life, if you would, with terminal illnesses. I am a end of life doula. I also have an integrated holistic practice, and I work with individuals on their health and wellness in their homes and through telephone. Also, I am looking for healthcare providers. I'm doing a 3-day training at Mount Vernon Country Club, Tuesday, Wednesday, and Thursday in the end of September. And it is secondary resiliency training for 3 full days on helping healers who are out there trying to heal on secondary trauma, promoting wellness through looking at burnout and compassion fatigue.
Sounds good. And I'm Pat Fredrickson, Vice President and Smarter Women Colorado. So I am here and looking for women 50 to 65 that need help with their retirement planning. I'm a financial advisor, and I bring together both sides of risk management, you know, in the market and safe money. So I'm looking for somebody that's got old 401ks and they need to move them, do something with them, take control of their life. Right now, we're going to go to our guest speaker, Wendy Bowser, who is with Health Benefits Pro and Bowser Insurance Health, and she's going to do health insurance tips for the entrepreneur. So Wendy, take it away, and I'm going to mute.
Wendy, I'm giving you access so you can be the host. And I will tell everybody, Wendy and I have known each other from the Houston area for years. And if it weren't for her, when I went into being self-employed, I don't know what I would have done about health insurance. So She's my lifesaver there.
Aw, thank you. Okay, let's see here. Screen share.
Can I have some? Try just be this.
We don't see your screen yet, Wendy.
Not
Everything
yet, okay. Sorry, this is taking a second, guys.
That's okay. We understand.
I sure hope this works. Let's see. I want to share that. No, this one. Here we go. Is it coming up yet?
Don't see it yet.
Oh, goodness.
While you're working on that, Kelly just joined us, and I think you're new. Would you like to unmute and tell us in 30 seconds or less what you do?
Hi, yeah, thank you for letting me join. My name is Kelly Jackson. I own a promotional products and apparel company. So we logo all the things from like Carhartt jackets to waterless tattoos to whatever you need, I can logo. And I also teach women and children how to fly fish.
Oh, sounds good. Okay, back to you, Wendy.
Okay, so I'm guessing you guys can see my screen now?
Yes.
Great. So I just want to say thanks again, Deb, for inviting me to join you guys this morning. Super excited to be here. But before I get started, I thought I'd share a few things about myself. Maybe it'll go. Here we are. As Deb mentioned, she and I have known each other a very long time. We actually met on Twitter and started following each other and having a great conversation there. And then we took our friendship offline at a cookie exchange and have been friends since probably at least 10 years, huh, Deb?
Probably.
Yeah.
About the Twitter thing.
Yeah, my husband and I have been married. It'll be 19 years next month. This picture was outside of the Baseball Hall of Fame in Cooperstown, New York, where we went for our 15th anniversary, though. I serve on the vestry at my church, which is St. Aidan's in Cyprus, and I'm a Sam Houston grad. Ironically, my degrees in journalism has nothing to do with what I'm doing now, but that's okay. Deb and I served on the board together at the Northwest Houston Business of Professional Women. I was president, she was president-elect, and she was such a tremendous help to me then, as I'm sure she is to you guys now. I'm sure some of you guys have fur babies. Here's ours, Gremlin and Jake. They're crazy, and they're so much fun. And I've been in the insurance industry for 14 years. Occasionally, I get the question from business owners and employees alike about health insurance and why do I need it? I'm not worried about getting sick or hurt, or I don't want or need the coverage. It's important to have for financial protection. I had a friend who several years ago didn't have coverage because she was worried about the cost, and she ended up in the ICU for several weeks. Thankfully, she's fine now, but it was a very rough time for her. And she actually tells that story every year about the time that the anniversary of it. And just the other day, I saw a story, I'm sure you have too, about a lady people who've been in the hospital with COVID without insurance, and that just breaks my heart. The reality is that most bankruptcies are tied to medical events, and a lot of them happen in families with health insurance. So health insurance provides financial protection in case you have a serious accident or illness. It limits the exposure that you have financially. A broken leg, for instance, can cost upwards of $7,500, while a major surgery coupled with a hospital stay can obviously be a whole lot more. When you have a health insurance in place too, you get access to preventive services, things like shots and screenings at no cost to you. Getting recommended Preventive services is a key step to good health and well-being. So your annual Well Woman is at no cost, as is your mammogram screening. However, if they do labs or maybe a secondary ultrasound, there might be costs associated with that. But it gives you a huge peace of mind. It gives you access to care where you're monitored. You build a relationship with your doctor. They know your history, so they can hopefully catch and treat things early. And if you don't have health insurance right now, there's a special enrollment provision going on where anybody can jump into a plan through the 15th of this month, actually. So if you have questions on that, we can talk about that later. I often get questions on frequently asked questions, things like, well, I don't know the difference between an HMO, an EPO, and a PPO. So I thought I'd share that with you today. An HMO is a health maintenance organization. Basically, you'll have a primary care physician who is going to help coordinate your care. So you have a person, you would go see them and they would give you a referral to see whatever specialist that it is that you need. In most cases, some you can just go directly to, but in most cases, you're going to need a referral to see a specialist. And there is no out-of-network benefits on an HMO. A EPO, excuse me, ladies, an EPO is an exclusive provider organization, and it's going to give you a little more flexibility where you can have, you can go see any doctor you want without going to see a primary care physician first. It's similar to a PPO, which a lot of people prefer, which the name is actually Preferred Provider Organization. So that's where you can go see, just wake up and go see whatever doctor you want. They do have in and out of network benefits, which is really nice, but an EPO gives you the same flexibility as the PPO, but it doesn't have the out of network benefits, and it's a little more pocket friendly. Some other terms that are important to know that I get asked about all the time that I wanted to share with you. Copay, that's a stated amount that the insurance company has negotiated that you'll pay when you go see the doctor. So if your copay is $40, when you see the doctor visit will cost $40. Deductible, that's what you'll spend before the cost sharing of the plan starts. So you have your copays and then you have your deductible. So if you needed to go into the hospital, they usually want to have that deductible met first, or a lot of things are subject to deductible. Well, that's the point where the cost sharing starts. So if you have a $3,000 deductible, and once you've met that, then what you would have is co-insurance. And I know there's a lot of crazy terms for early morning meeting for you guys, but the co-insurance is the percentage you'll pay between the deductible and the out-of-pocket max. So things like labs, you might see 30% co-insurance. Well, you would pay 30% of that bill, and then you would until you hit the out-of-pocket max. So a lot of people think the deductible is the most important number, and it is an important one, but really the out-of-pocket max is what you want to look at, because that's when the plan is going to pay 100%. That's kind of like you're all in as far as what your exposure could be. So for this year, the out-of-pocket max is $85.50 for the individual. So once you hit that number, prayerfully you don't. The goal is not to, but if you had something huge happen in your health for the year, the out-of-pocket max on a plan, if it's $85.50, your plan would pay 100% after that. Let's see here. So here is, you may have seen the summary of benefits before. Sometimes I get the question, I don't even know what my benefits are or where to find that information. Well, it's in your summary of benefits. So on this plan, I just realized this morning, it happened to be a Texas plan. I apologize for that, but the format is going to be the same in Colorado. This particular plan has a $4,000 deductible and an out-of-pocket max of $81.50. Now, You'll see here on the 1, 2, 3, 4, 5, the fourth line item, it says it has a 30% co-insurance. So you have your deductible, and then once you meet that threshold, you would pay 30% until you hit the 8150. And then you can also see here what it details the primary care and the specialist copays are at $40 and $80. Something I want to point out, you always want to check on the far right side, the limits, exceptions, and other information. That is where you'll see other things, what if it's maybe subject to deductible, or if there's some kind of a limitation on it. On the primary care physician line, you'll see that it says that virtual visits are also available as an item. And on the lab work and imaging, it says that a referral is required and pre-authorization may be needed for labs and images. Let's see here. This is a page on medication. So this would tell you what your copays on your medications are. If you're on a maintenance med, some sort of a cholesterol or high blood pressure medication, something like that, if you might find that a mail order for maintenance meds are really could be the way to go for you. They're easy. Sometimes they're less expensive, and it's really nice that it just shows up at the front door or in the mailbox. However, sometimes it's easy. It's good to ask if there's a generic available. I've had a situation where I had some sort of, it was years ago, I had a rash or something. And when I went to pick up the medication, that particular medicine was really expensive. So we called back to the doctor and got him to prescribe a different one that was a lot less. So that's something that you could do too. And of course, if you don't have the GoodRx app, download that on your phone because it's going to help you tell you where your best price is going to be. Sometimes it might not be with your insurance. Sometimes it just might be a cash price at a couple of dollars because sometimes those generics can be very, very inexpensive. I want to point out here to make sure that you know where your closest emergency room is and urgent care is. I always tell everybody this in my employee meetings because you never know when you're going to have a crisis. Just last week, I was out for a walk and was in the neighborhood adjacent to us, and I got distracted. Something happened across the street. I looked away. The sidewalk was broken, and bam, before I knew it, I was face first on the concrete. And I hurt my wrists and my knees and literally fell face first. I have a nice little bruise here that hopefully y'all can't see too much of, but it was not fun. But I went to the urgent care. Now, the urgent care copay on this particular plan was only $80, but if I had gone to the ER just to make, get checked out, it would have been a $500 copay plus 30% co-insurance. So you never know. I always tell people, like I said, make sure you know where those are because you never know when you're going to need it. And it's better to know ahead of time when nothing is going on than trying to figure out where your closest providers are in a time of crisis. The last thing I would want to point out on this here, make sure on your summary of benefits that you check what the other covered services here. On this particular plan, you'll see that there is coverage for chiropractic visits as well as hearing aids, and that there may be other benefits available, so you'll want to check your plan documents. So, and those you would get, you could probably access those in your member portal. Let's see. So for ideas, there's a short-term plan out there. Basically, these are going to be very basic. Some people tell me what health insurance used to be, very stripped down. They don't have any of the essential health benefits that are required by the Affordable Care Act. There are some underwriting questions. So someone with a pre-existing condition might not qualify for a short-term plan. Short-term plan was intended to be like a bridge to get you from one medical plan to another, maybe like changing jobs or whatever. But you can cover yourself for a month, 3 months, 6 months while you're waiting for your other coverage to kick in, or a year or longer in some cases. There's also marketplace coverage, as I mentioned previously. Right now, there's a special window because of the COVID that President Biden opened up the special window through August 15th. So marketplace coverage is Obamacare, and these are fully insured plans, so there's no health questions whatsoever. So we'll enter your information, including your household income, into the system and see what you're eligible for, may be eligible for in terms of a subsidy to help offset some of that cost of the premium. There's also sharing plans out there, things like MediShare and Zion Health. Some of these plans have a faith-based component to them, so they'll require an attestation of faith. They are not fully insured, so they do have some limitations for them, but they are a good option for some families. And the lastly is group benefits, which depending on the size and the structure of your company, you might be eligible to do, or you might be able to do group benefits. Some insurance companies have groups available for just 2 employees. And at the end of the year, there's a participation holiday where they throw all the participation windows out, participation requirements out the window. So that is helpful for some companies to be able to set up their group plan during that time. So if that's something that would work for you, here are a few reasons why to consider it. Studies show that employees will choose a job with a lower wage to gain access to benefits. Right now, companies that are offering benefits actually are able to, with everything that's going on in the job market, the employees have a little bit more leverage. And so having benefits and stronger benefits are super important right now in terms of talent attraction and retention. Long-term training and recruiting costs are lowered because people stick around where benefits are being offered. And of course, there are tax advantages to you as the employer. And lastly, people who actually go to the doctor proactively instead of waiting until it's later in their illness or injury, which can result in longer times out. And we're able to better focus because we're not so worried about what's, our financial situation. There are other kinds of insurance that are available, not just to group, but to the individual as well. So if you're to the self-employed, things like supplemental, so those would be accident, cancer, critical illness policies. Short-term, long-term disability is available individually. Life insurance, dental insurance is available there. That's actually the second most requested type of insurance out there. And then vision and pet insurance and lots of other fun stuff. So I hope I've given you some good food for thought this morning. If you have any questions, let me know. And Deb, thanks again for inviting me to visit with the group this morning. And I'll stop sharing my screen. Whew, goodness.
That was a lot.
Yeah, I tried to make it quick, but okay. I'm showing your speaker notes. Oh, goodness. Sorry, guys. I didn't know I was showing my speaker notes.
It actually helps.
Goodness. I hope I didn't talk too fast. Does anybody have any questions?
Wendy, I just want to make sure that you are licensed in Colorado. Is that correct?
Ma'am. Yes, ma'am.
Yeah, I'm a licensed insurance agent. I will not touch health insurance. This is a very complicated area. I do Medicare. I'll take them at 65, but you are more than welcome to have everybody before that. It is huge, and it's very, very important right now. And I would assume that you're going to get extremely busy because a lot of people were able to go on Medicaid, during COVID because they had no jobs, et cetera. And now they're going to be coming off that. So it's very important to get back into health insurance. And you were talking about dental insurance. Chrissy and I keep looking at different dental plans. And if you have something great, please let Chrissy know because she's a standalone hygienist and this is difficult to find. I've not found anything that's too exciting, that goes with Medicare. So if you've got something, I would be more than happy to share that also.
Okay, sure. I'm thinking of one particular carrier, Pat, but I'll research the age ceiling on that and let you know. Thank you.
Yeah.
I can't believe I was sharing my speaker notes. How embarrassing.
Wendy, are you
Ma'am.
in Colorado or are you located somewhere else?
I am actually in Houston.
Okay.
And yeah, so, but when I come, Deb and I have talked about me coming to visit, so hope we'll have to plan it when you guys are going to have a meeting so I can meet everybody in person.
That would be great.
Yeah.
If you're talking to an employer here in Colorado, would you do that via Zoom or how would you set that up?
Probably initially via Zoom.
Okay. Just curious because I am an office manager for a heating and air conditioning company a couple days a week. And I have really been trying to encourage him to add in medical care for his employees because of the retention. That's a big issue right now. And I agree with you 100% on everything that you shared. And I myself would love for him to be able to add something because it would be a lot better price-wise overall. Because yeah, I'm paying a pretty penny out of pocket.
Yeah, it's
as an individual.
I work with a couple of HVAC companies here in town, and I've got a digital platform that we can do everything enrollment-wise on. So there's no chasing paperwork, which would make it easier for the office manager to help in that. So yeah, we can do everything virtually.
Awesome. I may be reaching out to you.
Thank you, Beth.
Did you put your information in the chat? And anybody, right now we can't pass business cards. And
yeah.
I have everybody's email address, but I don't have your phone number. So if you can put it in chat, and I'm going to figure out how to save it.
There's actually a way to download the chat to your, I think you just hit file and it'll download it to your drive.
Oh, okay, great. Yeah, because I would love to have everybody's phone number in here because every once in a while something comes up and we do want to reach out to you quickly. Okay, any other questions for Wendy? Thank you so much. That was very informative.
Thank you, ladies. I appreciate it.
Okay, now we're going to hear from Jacqui.
Yep.
And yeah, more about health information. It's a big one. And as we age, all of a sudden, I'm discovering things happen. And yes, you need all these insurances and you need to understand how to use them. I got billed the other day $2,700 for a procedure, and it turned out it was only $134. So yes, you really need to know what your insurance is about. So anyway, Jacqui?
We see your screen, but
Sorry, I forgot to unmute myself before I started.
we get.
Hi, everyone. I'm Jacqui Angelo, and I am a holistic transformational nurse coach. And I'm actually kind of glad that I'm on the heels of Wendy's presentation because it sort of meshes a little bit, a couple of things with what I wanted to talk about today. So if you do not take time for your wellness, you will be forced to make time for your illness. That's a quote that I love about health. Today's modern healthcare is really sick care, and it's designed to keep people sick. And that's kind of my opinion, but I really feel that it's designed to keep people sick and dependent on the system. If you think about it, wellness care is rarely paid for by insurance. Sometimes they will pay for massage with chiropractic, but they don't generally pay for acupuncture, Reiki, coaching, anything like that. And how many times do you go to see your doctor and you've got a 15-minute appointment window to talk about what you need to talk about? And sometimes you need to talk about a lot, right? Generally, a lot of times the doctor will just say, well, here's a prescription for that. And your appointment's over and you really don't get a chance to talk about a lot of what you want. And then sometimes you'll get side effects from the medication. So you'll go back to your doctor and they'll give you another medication to deal with those side effects of that medication. And the cycle continues to repeat itself. And before you know it, you're on like 10, 15 different medications. It really happens. I'm not making that up. But this doesn't have to be your experience. So you can work with a trained healthcare provider or registered nurse to learn how to heal your body from the inside out. Because really that's where it starts, is on the inside. Holistically reducing your dependence on medications and procedures, and therefore reducing your exorbitant healthcare expenses, which Wendy was talking about, how expensive insurance is. I remember when I started in nursing 30 years ago, healthcare was fairly inexpensive as far as your out-of-pocket costs go. And it's skyrocketed throughout the years. So with a nurse coach, you can learn how your gut health affects every aspect of your health and wellness, and how you can sort of learn to manage that, among other things. But you can feel better with a nurse coach. And I like to say your health is not an expense, it's an investment, because a lot of people are hesitant to pay for coaching, but they don't realize the benefits and the investment that they get with that. So you might be wondering, well, why should I work with you instead of my doctor? Want to make it very clear, I'm not asking you to work with me instead of your doctor. I like to work with your doctor's plan for you. But I'm trained in holistic nursing. I've been a nurse for 30 years. I'm continually expanding my knowledge and my education around holistic health. And I have a coach myself. I really believe strongly in that. As a nurse coach, I'm simply the vessel for you to be able to tap into your own strengths and your own abilities so that you can overcome obstacles that are impeding your progress or your health and wellness. You don't diagnose and treat. I don't do that at all. And I don't ever ask you to stop taking medications without consulting with your doctor first. But I will work with you and your doctor to help you find some alternative approaches so that you don't have to be taking so many medications. So today I want to give you a glimpse of what coaching is like. First, I'm going to give you just a little bit overview of this current state of healthcare in the United States. And then I'm going to talk to you about nurse coaching and why you can benefit from a nurse coach, why the investment is an invaluable investment for you to make. And then I want to do a quick exercise with you guys to just give you a really quick glimpse into what coaching might entail. So about healthcare. Oh, I am not forwarding my. So leading causes of death. You may have seen some of these slides before if you've been in a presentation of mine, and I'm not going to go through them like in detail, but basically heart disease and cancer are the two leading causes of death, and now COVID is third in our country. And really most of the leading causes of death, except for accidents, are preventable. And so with that, with healthcare spending, based on Wendy's presentation, my estimates are far lower than hers. I have $11,000 per person of spending in 2017. So that's actually already 4 years old. So it's definitely gone up. And it just keeps growing and growing and growing and growing. And so prescription drugs and other types of healthcare issues constitute 15% of that spending. And hospital care constitutes 33% of spending. I really believe strongly that hospitals should be used for emergencies only, because we can prevent most of the hospitalizations that are out there and the reasons for them. So this is a really good slide. It just talks about US statistics on spending. The US spends more in healthcare as a share of our economy, nearly twice as much as other countries, but we have the lowest life expectancy and the highest suicide rates. So that's pretty sad statistic. We have the highest chronic disease burden and obesity rate. And we have the highest number of hospitalizations from preventable causes. We do have a few good things in there. You know, we have fewer physician visits and peers is good or bad, depending on how you look at it. If you're healthy, it's good. If you're not healthy, it's bad because you're not getting the care that you need. Oh, and I'm going to go through these really, really quickly, but basically just talking about the prevalence of obesity is growing exponentially. In most states, it's over 50% now. Colorado does have the lowest obesity rate in the country right now, but we are climbing just with everybody else. Heart disease, unless it's a congenital issue that you're born with, heart disease can be prevented. It really can. And you see a healthy heart versus a damaged heart. So I'm going to skip that one. Hypertension is another really common issue, and it's the majority of the time preventable, just based on your diet and your lifestyle. Diabetes. Diabetes is getting out of control. There used to be juvenile diabetes and adult onset diabetes, but because of obesity rates just growing and growing and growing, and the number of children who are obese, they've actually labeled them type 1 and type 2 now, because so many children are experiencing symptoms of adult onset diabetes, and so many adults are now taking insulin for their diabetes. Skip that. Kidney disease is another thing that's really prevalent, and the leading causes of kidney disease are diabetes and hypertension, both of which are preventable. So again, unless you have a congenital anomaly that you're born with, kidney disease is very preventable. 9 in 10 adults with chronic kidney disease do not know they have it. If you go into stage 5 kidney disease, you have to go on dialysis, which is not fun. I actually was a dialysis nurse for quite a few years, and it's miserable. It's really miserable. And most patients on dialysis need a transplant. So we want to kind of avoid all of that for you. So I want to talk a little bit about nurse coaching, why work with a nurse coach. And then I'm going to get in a little bit to my own experience and career. So nurse coaches have to be nurses. They have to have several years of education, experience, skills, and training to be considered a nurse coach. Clients can get health coaching now with people who are actually licensed medical professionals and have that experience and knowledge. So that's a really good thing. I have another slide. I think it might be the next one. Yeah, so traditional health and wellness coaches are process experts. So they help you through the process. Whereas nurse coaches add a level of content and expertise to provide a medical level of coaching and content experts. So we understand the content. And I'm not saying that health coaches who are not nurses don't understand that, because there are many who do, and there are many who are really good. And so, but nurses just have that added level of understanding medications and understanding physiology pretty well. So a quick little tidbit about, studies in nurse coaching. Although there haven't been a lot of studies because it's really an emerging field, But although the probability of incurring costs for emergency services weren't affected that much, incurring expenses related to preventable disease can fall significantly. So the estimated savings, you can see here, $3,400 a year for an individual or for outpatient, and then almost $5,000 a year total, which is pretty significant, especially when we're paying that in our deductibles pretty much. So I kind of move my slides around. This is normally my first slide, but so I just want to, on the heels of that information, the reason I gave you that information first is because I really wanted you to hear and see those statistics and why nurse coaching is really a good thing. So it's my vision to provide holistic transformational health and wellness coaching so that all individuals can live lives free of medications, surgeries, and life-limiting illness and disease. So that's really important to me. And the longer that I've been a nurse, the more I see how the current system just keeps people in those cycles, because doctors don't have the time or honestly the training to talk about wellness with their patients. So I've been a nurse for just about 30 years, lots of different experience in different areas of nursing, and I have education, experience, and skills to understand lots of different diseases, medications, and how to manage diseases holistically from a more holistic approach. So originally my goal was to work with healthcare and allied health professionals, but I like to work with anybody who is really wanting to better their healthcare and to just live a different lifestyle so that they live healthier. So we're going to do an exercise right now. I want you to think about a dream or a goal. Before I start that, does anybody have any questions so far? And if you're typing in the chat box, I can't see it because I'm on full screen. So I'd like to do a little bit of a quick exercise. I want you to think about a dream or a goal that you have, or something that you've been thinking about for a long time. And it can be health related, but it doesn't have to be. It can be any kind of a goal at all. It can be a financial goal, a personal goal, a dream, anything like that. It can be health or not. So what I'm going to do is I have a deck of cards here in front of me, and I'm going to shuffle the cards, and I'm going to pull a card. Actually, it's a small deck. And I'm going to ask you the question that's on the card. And I want you to answer the question in relation to your dream or goal. So the question is, actually, this is a two-part question. What self-limiting belief is stopping you from achieving your dream or goal? How would your life be better if you rid yourself of this belief? So I just want you to take a minute and just kind of think about this goal that you've had and you've been putting off for whatever reason. A limiting belief, a self-limiting belief is something like, well, I want to start exercising, but I just don't have the time. I just don't have the time is a limiting belief. So just think about your goal for a minute. So I'll tell you what my dream is. My dream is I've always wanted to participate in a medical mission, and I never have. And a self-limiting belief that's been stopping me throughout the years, I've had different ones, you know, who's going to take care of my pets while I'm gone? How am I going to come up with the money to do that? Because that's a volunteer thing and you have to pay for it yourself. I can't get the time off from my job to do this. These are all self-limiting beliefs that I have had about this. And so I want you to kind of think about it, and I want to ask you, like, what's coming up for you right now? thinking about this. It might be something that feels uncomfortable for you, and that's okay. That's kind of the point of doing this. And for what's coming up for me is I don't want to come to the end of my life and not have done that. And so I need to think about how can I make that happen. And the other question I want to ask you is, what is keeping you from achieving your goal or dream? And for me right now, it's nothing. I need to do some research. I need to find out where I want to go. I need to save the money and do it. Actually, one thing that might be keeping me from achieving that goal or dream is the amount of vaccinations that you have to get to go to some of these countries. I am not anti-vax by any stretch of the imagination. I believe vaccines are important, but I'm not sure how I feel about that many at one time. But that's something that I have to work through. Does anybody want to share a dream or a goal that they've had? I'm getting close to the end of my time, but does anybody want to share anything? So I just want to say that with nurse coaching, a lot of times people come to me with a goal or a dream or whatever the situation may be, usually a health goal. And then we start working together and we find out that there's a lot of stuff underneath that needs to be healed before we can even begin to work on the health. Generally speaking, I think, not generally speaking, a lot of times people who are not able to achieve their health goals have some underlying issues that they need to work on. And a lot of times what I found in my practice is that we start there and then we move into the weight loss. So I use a mind, body, spirit approach because I believe a holistic approach is really the best way. Disease and illness is not one thing. It involves all of us, the whole of us. And then I know we're running out of time. I just wanted to quickly tell you what you can get from me. You can get one-on-one coaching. And I do virtual. I was planning to do in person. We'll have to see kind of what happens with COVID right now, but I can do virtual or on the phone with anybody. Group coaching is something that I'm going to start doing, and we can do, groups for weight loss or groups to quit smoking or groups for exercise or any kind of groups. So you might get a poll from me asking, what would you like to work on? I am working with a yoga instructor and we are starting a women's group together. And our first one will be August 23rd. And it's going to start at 5:30 in the evening. So I can send out information on that. And then I'm also going to be doing circles and workshops. And the reason that I said in the beginning, when we were introducing ourselves, that I'm looking for nurses is because I want to start nursing healing circles, because nurses are really burnt out and stressed out right now, especially with COVID, and they really need a way to heal. And so that's something that I'm also going to be working with. So I feel like I went super duper fast and I'm sorry about that, but please feel free to contact me at any time if you have any questions or if you're interested in learning more. This is my contact information here, and I did also put it in the chat. And you can also find me on social media.
Thank you very much, Jacqui. That was really informative. A good day on health for us between the insurance and then Jacqui's coaching. If you have any of those classes, if anyone else has any class coming up, please email it to mountainwomeninbusiness@gmail.com. And I will put it in any of the newsletters. If you have any classes, anything coming up, let us know. So it is 9 o'clock. We do try to end right then. Thank you very much, everybody, for coming today. And we are working on finding an in-person meeting place. It's a little difficult in the Conifer Barely area, but we will be working on that. And thank you. Have a great day and a rest of the week.
Thanks, everybody.
Hi, everyone.
Thank you.
Thank you, everyone. So nice to meet you all.
Bye.
Be well. Take good care.
Be well, Mary and Pat.
Thank you.
Mhm.